The Spirit Catches You When You Fall Down is the tale of Leah Lee and her family, Hmong refugees from Laos who have resettled in the United States. Leah is diagnosed with severe epilepsy, and this book details the culture conflict that obstructs her treatment. Anne Fadiman is an American essayist and reporter. She narrates this book, which serves as a chronicle of the modern immigrant experience, and perhaps more importantly, as a discussion piece around the limits of Western medicine. Fadiman alternates each chapter about Leah and her family with one about the history and culture of the Hmong. Western medicine dictated that Leah was best treated with a complex array of medicines which Leah's family neither understood nor were able to administer. The Lees preferred a combination of Western medicine and Hmong remedies designed to coax Leah's wandering soul back to her body. What ensues are 4 years of culture clash and miscommunication. Tragically for all involved, Leah suffers a grand mal seizure at the age of 4, resulting in the loss of all of her higher brain functions. In this book review, I hope to explore the core issues and problems, how it is that two parties, the doctors and Leah's family, who had one common goal, that is Leah's well-being, got it so wrong. Let's begin with culture clash, which is perhaps the most common and important theme throughout the book. A key feature of the Hmong is that they have no interest in being ruled, nor in ruling. They just want to be left alone. They do not like to take orders, do not like to lose, are not intimidated by being outnumbered, and are rarely persuaded by the customs of other cultures. They would rather flee, fight, or die than surrender. The word Hmong itself is usually said to mean free men. Next, let us turn our attention to power. We've already established that the Hmong do not like to be ruled. In the healthcare setting, this means that they won't just do something because someone more powerful says to do it. The biomedical model requires that the patient be a compliant one. Most of the power lies with the doctors. Engel, 2012, states that biomedicine has become our own culturally specific perspective about disease. That is, our own folk model. Arthur Kleinman, interviewed by the author for this book, suggests that the model of biomedicine has a role to play here. As powerful as an influence as the culture of the Hmong is on this case, the culture of biomedicine is equally powerful. Time and time again, doctors are exasperated in their work with the Lees. Fadiman states that she was struck by the staggering toll of the stress that the Hmong exacted on the people who took care of them, particularly the ones that were young, idealistic and meticulous. The Hmong do not comply with the model of biomedicine. One of the only doctors in Merkid favoured by the Hmong, ironically, is one who is held in low esteem by his peers. His strength, it seems, is that he doesn't force patients to comply with the American medical practices. And when asked by Fadiman why not, he states, it's their body. This is about giving the Hmong some control, some ownership of their care, and ultimately this tips the power balance in favour of the patient. Was evidence-based medicine overly subscribed to here? Were the doctors trying too hard to apply evidence-based reasoning? Strauss and Jones in 2004 suggest that the desire for optimal treatment can result in application whereby the art of practicing medicine is replaced purely with science. Unfortunately for Leah and her family, their doctor, Neil Ernst, saw their non-compliance as tantamount to child abuse. He requested that Leah be placed in foster care to allow her medications to be administered exactly as he prescribed them. This results in a year during which Leah is removed from the care of her parents into foster care. This is the ultimate power play by the doctors and enrages the family. How can they be stripped of their power in a country to which they have fled because of its reputation for freedom? By the time Leah was returned home, her medical regime had been dramatically simplified, and from then on her medication levels were therapeutic. That is, her parents were compliant with the regime. This did not, however, result in Leah getting better. Closely linked to the themes of culture clash and power is that of labelling and stigma attached to the Lees and all of the Hmong. Some of the terms used are listed here. All of these terms stem from a lack of understanding and uneasiness when confronted with difference. Lincoln Phelan in 2001 defined stigma as the co-occurrence of its components: labelling, stereotyping, status loss, and discrimination, critically adding that for stigmatisation to occur, power must be exercised. It takes power to stigmatise. The lack of understanding leads to a stigma and labelling, which in turn leads to blaming. The Hmong react to blame or threat by fighting or fleeing, as we've heard before, which in the medical arena translates to as non-compliance, driving a further wedge in the therapeutic relationship. Now let's compare models of health. Holtz and others in 2006 state that complex health problems are insoluble without understanding the social context. The Hmong view of healthcare is the opposite of the prevailing American one, in which medicine has split into small subspecialties. Hmong treatments are holistic. The Tsineng or shaman doctor would home visit and spend as much as 8 hours in someone's home, compared to the forced hospital or doctor visits in the Western model. The Tsineng is polite and never asks questions, whereas doctors ask rude and invasive questions, and so it goes on. With regard to epilepsy, both Hmong and Western cultures understand it, but attribute different causes. Of note, the Lees had diagnosed Leah with Kauda-Pei, or epilepsy, 5 months before Western medicine was able to make the same diagnosis. Shahid and Thompson in 2009 discussed social cognition models which attest the importance of people's beliefs in determining their health-related actions. They also discuss that the belief system comes from multiple factors such as shared family values, relationship with the family and the community, environment, past experiences and cultural identity. So when most aspects of society are so diametrically opposed, where are we to find some solutions? We have seen that there are many social, ethical and professional issues at stake. What is the way forward? Bilatu, a Hmong medical administrator in Merck, has many suggestions as listed here, but states that most importantly, conjoint treatment is required. That is, a little Western medicine combined with traditional healing. Fadiman makes an argument for greater cultural competence in doctors and states that universities are slowly implementing cross-cultural training. Scambler, 2009, would agree that better informed publics and sensitised professionals are barriers against virulent cultural stereotypes. Fadiman meets with Kleinman and comes to terms with his explanatory model as an opportunity to open clinicians to human communication and set their expert knowledge alongside the patient's own explanation or viewpoint, as written by Kleinman and Benson in 2006. I wondered about the opportunity for an assets-based approach in this case. Brooks and Kendall in 2013 discussed that in order to meet the health needs of people and communities, they need to be conceptualised as more than just recipients of healthcare. Deficits-based models can result in individuals, groups, or even whole communities being seen negatively, as happens in the case of the Lees and the Hmong in general. Morgan and Zigillo in 2007 report that many of the assets that are key to the creation of health and well-being are located in the social context of people's lives, and attest the significance of an assets-based approach as offering both credibility and solutions for marginalised groups and communities. The Lee family in this story have some amazing assets, especially in the social realm. But very few, if any, of these assets were utilised by the doctors involved in this case. I see the asset-based approach also as an opportunity for an empowerment and autonomy for healthcare recipients. In 2007, Marmo wrote that people need to have control of their lives, and they need a political voice and participation in the decision-making process. Finally, I come back to an idea touched on earlier by one of Leah's doctors, that perhaps the most important element missing in many of the interactions that the Lees have with their doctors is compassion. Kleinman and Benson suggest that finding out what is important to another person is not a technical skill, it's an elective affinity to the patient. This is much different to cultural competency. So I pose this question: what if the most important thing we could instill in healthcare workers is working with empathy, the importance of focusing on the patient as an individual, not